Hello everyone, my name is Dr. Mohit Kukreja and I'm a consultant arthroscopic surgeon at Wokhart Hospitals, Mumbai Central. My specialty of interest is treating sports injuries with arthroscopy and doing shoulder, elbow and knee surgery. So today we're going to talk about what exactly is the ACL ligament and more about its injury. So the ACL ligament is one of the major ligaments in the front aspect of the knee, which connects the shin bone and the thigh bone as an attachment. So it's a taut ligament and its main function is to stabilize the knee. Usually it is torn when there is a sudden change of direction while running in sports or also in the general population. Also when there is sudden movement, jerky movement, which leads to a twist in the knee, it leads to a tear of the ligament. So what exactly are the symptoms, or how much should we be concerned if you have a knee injury? So if you have an ACL tear, probably on the day of injury, you'll have a lot of swelling in the knee because of blood collection. At the same time, you'll not be able to walk. And of course, as days pass by, you'll have symptoms of instability in the knee, or the knee being loose or kind of weak, and something not holding the two bones together. There'll also be episodes of recurrent buckling or kind of subluxations of the knee, which will cause pain, and of course this leads to cartilage damage. In terms of treatment options, I would like to clarify that not all patients of ACL injury actually need a surgery. There are some conservative options for the right population. However, most of the times, because it's a stabilizing ligament and we need to avoid future arthritis, it is imperative for us to do some kind of surgery on the ACL. So the most common surgery that is done is the ACL reconstruction surgery. But recently, with advanced techniques, there are ways to actually repair the native ACL instead of reconstructing it. So if you're suffering from ACL tears and you want to know more about it, please get in touch with our department at Wokhart Hospitals, Mumbai Central to know more about your problem. Thank you so much.